Hi everyone. I hope you're having a good day. I wanted to go over a few myths about labor induction and going past your due date or um, things that might increase your risk for cesareans and things like that. So the first thing we would really have to look at is what is a due date. And the due date that we go by is given from our doctors. It's either by your LMP, which is your last menstrual period, or by a sonogram. And the best way to get an accurate estimated due date, an EDD, is with an ultrasound. So, with that being said, according to your estimated due date, which you'll hear referred to as EDD, the length of time that you're pregnant is normally 40 weeks. That's what we are told by doctors, nurses, and the birthing community in general. However, we have come to find out through evidence-based birth that the actual amount of time that you are pregnant is around 41 weeks. I believe the actual stats on that is 40 weeks and 5 days. So it's not abnormal for you to go past 40 weeks. It's not abnormal for you to go 41 weeks or even 42 weeks. Once you hit 42 weeks, there is a relative risk of stillbirth, and the study is about 1 in 1,000 stillbirths after 42 weeks. And that's something you would have to weigh your options, benefits versus risk, and that's a personal decision you would have to make with you and your partner and your doctor or midwife. But 40 weeks is not actually your time in pregnancy. Normally it's closer to 41 weeks and sometimes even 42 weeks, and that's okay. And sometimes when we hit the 39 weeks, we start going, well, how do I speed up labor? How do I go into labor? What's a natural way to induce? I get that question a lot. The best thing I can tell you is baby's going to come when baby's going to come. There's nothing that we can do to make your body go into labor naturally. There are things that we can do to prepare your body and to help keep you in shape and get your body ready for baby to come and to shorten the length of labor, that sort of stuff. But as far as actually inducing your body into labor without the use of medications in a hospital, that's not going to happen. Now, there are things that we can do to help bring on labor if your body is already ready and if baby is ready and in the correct position and everything else is right. There are things we can do. The most common and well-known and researched is, of course, sex and nipple stimulation, because it produces oxytocin, which is what they give you in the hospital in the form of Pitocin to induce labor. And so that's a natural way to help start things if your body is ready. And if your doctor is giving you the okay to do that, then that is a natural way to start things. We hear a lot of use of castor oil, and that used to be used a lot in the past, and we hear it used even nowadays. That is very controversial. It's like a 50-50% chance on you actually going into labor with it. The side effects can be somewhat negative in that they can cause a lot of cramping, diarrhea, nausea, vomiting. And if you've got that going on and then it sets you into labor, you've got a lot more to deal with than just the onset of labor and your regular contraction pain. You actually are dealing with more of like a stomach virus feeling plus labor, and that's not something we want for you. That's not something we want for your body to go through. So castor oil is very controversial, and I would suggest doing research on your own on whether or not that's something you want to do, and talk to your provider as well. Red raspberry leaf tea. We hear about it all the time, and everybody thinks and wants to think that it can induce labor or it can start labor. What it actually does is it can prepare your body for labor. It can shorten the length of your actual labor in time, not speed it up, not bring it on. It can help prepare your body, but it's not going to actually bring on labor itself. We hear walking, if you walk enough, then, the baby's going to come. And it's nice in theory, and it's great for your heart health. It's great for your body in general in pregnancy to walk and to do low impact type of exercises. It prepares your body, does not bring on labor. It can help the baby to descend into the pelvis. It can help get things aligned and ready for labor. And once you start labor, it's definitely a comfort, and it makes you feel a lot better during contractions to be up and moving, and it can help to speed that up, but it's not going to actually induce you. So basically, like if you're in the bed and you say, okay, I want to induce labor. If I get up and go outside and walk, then I'm going to go into labor. That's not accurate. And that's not me saying that. That's coming from Evidence-Based Birth and ACOG and the American Association of Pregnancy. It's not going to just set you off into labor unless you're high risk and you're on bed rest and you're not supposed to be up walking. So again, always check with your provider, your doctor, your midwife. So I guess in conclusion, the best thing for me to say, and the best information I have and the most helpful information I have is know that your body will allow your baby to come when your baby is ready, when his or her lungs are mature, all of his features and organs are ready to come out into the world, and your body is physically ready to go into labor. You certainly don't want to go into labor when you're sick or tired or emotionally upset. So your baby's going to come when he or she is ready to come. Your body's going to go into labor when it is ready to go into labor. Doing all these things that I've mentioned, exercise, red raspberry leaf tea, staying in shape, and just drinking lots of water, that sort of thing, those are all beneficial, definitely during pregnancy. They're great. But they're not going to cause your body to go into labor. You'll go into labor when your body's ready to. And if that's at 42 weeks, that's okay. Sometimes a lot of moms give out an estimated month that they're going to have their baby instead of an estimated due date. So that if you're due on April the 2nd, which is tomorrow, then on April the 2nd, when you get 500 phone calls, you're not having to say, no, I'm not in labor, and no, I'm not in labor, and no, I'm not in labor. And people aren't giving you 500 different options on how to go into labor, or asking you if you're going to get an induction or if you're going to have a cesarean because you're at 40 weeks. Sometimes it's better just to say, hey, I'm due around mid-April, or I'm due in the month of April, or, I'm due in spring. Give them a big, broad, vast time frame to work with, because your baby's going to come when he or she is ready, and we can't predict that. We can get as close as we can, and doctors and scientists have come a long way in trying to help predict that. But again, it's all up to your baby and your body. So I hope that's given you a little bit of information. If you have any questions, feel free to ask me. You can go to my website, which is www.jonigallman.com. Feel free to ask me any types of questions that you have. I'd be glad to answer. I can answer on here, or I can answer through email. I hope you all have a great day. Talk to you later.